it doesn't cut you off.
Okay. Good morning, everyone. Good morning, everyone. Hello. We're just going to give everyone a few minutes to settle. Just say hello and where you're joining us from today. Get settled, grab a coffee. Seems like everyone's coming in. Sometimes there's a 15-second delay, so we're just going to give it a few moments. So again, everyone just say good morning and where you're joining us from today, if it is morning where you are. And just let us know in the chat on the engagement panel on the side if you can hear and see us and see the presentation. Perfect. Just wait a few more minutes for everyone to join. And we will get started. So hello and welcome to TMF Week 2022. Thanks so much for joining us today for the 5th and final day. So our next session, what would I find in your TMF? The top 10 problems and the best practices to avoid them. My name is Jen Tuvierge and I work on the sales team here at Montreal. And I'm super excited and honored to be your host for today's session. So before we begin, I'd like to, again, just double check now that more people have come in that you can hear and see us. Perfect. So before the fun begins, I'd like to go over a little housekeeping to ensure you know what to expect and that we're all on the same page. So all the TMF Week sessions will be recorded and made available at the end of each day, as well as all of the slide decks. And each attendee will receive a certificate at the end of the week so you can show off all of what you've learned. And feel free to use the Q&A section to submit questions at any time. It's an interactive session. So in the side panel, feel free to add any questions that you have, and we will go over them at the end of the presentation. And feel free to network at the end in the lounge or the Montreal booth. So now that we've gotten all the rules out of the way, I would like to introduce your speaker for today, Daniel Bennett. So for the last 10 years, Daniel has worked in various TMF roles for both large pharma companies and small biotech, with a full-service CRO and a specialist TMF provider. So having seen the issues from all sides, he's a convert to the idea that the TMF is a key part of a quality approach to clinical trial management. He was very involved with the development of sub-artifacts in the TMF reference model and is excited to see and talk about how companies make use of the changes to deliver better quality TMFs and better oversight. So welcome, Daniel. I'll pass the baton over to you and let you share your screen and begin your presentation.
Thank you. Let me do that now. Try and select the right bit and share screen. Oh. There we go. Hopefully seeing the screen now. Super. My topic is, what would I find in your TMF? And specifically, meaning by that, what problems might I find in your TMF? And what could we do about that? What best practices exist to reduce or correct or mitigate those issues? Let me start with a disclaimer that these are my views. They're not necessarily the views of my employer. I'm not speaking on their behalf, nor are they necessarily the views of anyone I have worked in the past or the future. Just giving you my opinion. In fact, some of this isn't even really my opinion. It's just some thoughts to get you talking, get you thinking. And I'm going to start with a second disclaimer as well. These are all generalized and anonymized. When I started working in the TMF, the very idea that you would have people who were focused on the TMF was almost sort of unmentionable. It implied that something had gone terribly, terribly wrong, and you had begun to engage in some kind of last-minute remediation. You were doing a late in the day scramble to try and fix things. In contrast to that, and certainly anyone who would be at TMF week or some other TMF event takes a much wiser approach that actually it's part of doing things right. It's seen in a different way. So what matters is not whether you have issues, because we all have issues. It's whether you notice them and whether you do anything about them. I suppose if I'm honest, it also matters how many of them you have and how much impact they have. But we all face challenges and it's all a work in progress. So let me press on, because I've committed myself to getting through 10 issues with solutions in a relatively short talk. So here we go. Number one, at some point in the past, I was involved in a big survey of the issues that we were finding across multiple TMFs. And I think at the time I was probably talking about tens of TMFs, and I was drawing on data from colleagues across perhaps 100 or 200 TMFs. And by far the most common finding and common issue is that ethics, when you looked into the ethics section of the TMF, you did not find the whole thing. You did not find that it was complete. It was fairly straightforward. If you focused on it, it was fairly straightforward to see that there was something missing. There was a completeness problem. Sometimes things were very incomplete. So rather than a piece being missing, there was just enough present so that you knew a lot was missing. So sometimes you might have 30 documents and think, shouldn't there be another couple? Other times there might be 3, which is just enough to convince you that you did send some letters to an ethics committee and you were expecting something back from them, and you're supposed to file it in the TMF, but really not adequate to demonstrate that the trial had been ethically supervised. So what can you do about this? Because it is remarkably common. Well, and apologies, this is the best photo I could find for Googling when sponsors talk to health authorities or ethics committees. This is not meant to rock your world. This is not meant to be a huge surprise, but I would advocate that you review your TMF before an inspector or an auditor or someone else does. You have a look and find if it's missing, and if it's missing, you do something about it. That's probably not come as a great surprise to anyone, but you can't miss saying the obvious. So the way I do it is I think of it as a dialogue between the people running the trial and, in this case, the ethics committee. So how do I do that? Apologies, the text here is far too small to read. I don't necessarily intend that you study every word of this, but in the top half is a typical view of how we list our documents in a trial system. That isn't real information, that's just me writing in Excel. But there is some data for the ethics approval of a trial. It's all the stuff from 411 and 412. And it's listed out in date order. So as you work your way down, you should be able to tell a story. But it's pretty hard to tell whether you've got everything or not. Particularly when, like this example, it's pretty good. So the method I favor, and I'm trying in this talk to be quite specific and detailed and practical and helpful, having previously talked about bigger concepts and the like. Here are some absolute take-home ideas, or leave it here if you don't want. But split it into 2 parts. So having put it all together in time, you should then be able to sort of go through and split it out. Well, first up, we sent them a letter, and then they sent us a letter. And then you go back to the left-hand column and we sent them another letter. And then finally, they sent us a letter that was called an approval. And it's quite simple in those terms, that on the left-hand side, you see the dates of what we sent. And on the right-hand side, you see the dates of what we got back and filed. And hey, it's pretty good. It all makes sense. That's a story that makes sense. The first bunch is the initial submission. The second bunch is called Amendment 1, which is promising. The third one's a notification. And the fourth one's called Amendment 2. It all kind of hangs together if you've got that information and you lay it out like that. You can see at a glance that it's right. or actually you can see it's very, very nearly right because there's an acknowledgement of receipts missing. But you can only see that when you lay it out properly. You can't see that necessarily in the list above. So there you go. A way of reviewing your ethics interactions to determine whether they are complete or not. Of course, that's rather simplified. That was only 411 and 412, so it missed out if anyone got confused about notifications and safety notifications and reports and all the other stuff that gets in there as well. That may get in the way and make it a little bit more confusing and complicated. But there's some other problems here as well. Ideally, I'd use a metadata field to mark off the initial one rather than write initial in a free text field. Very likely, I hope you are QCing your submission packages before you send them, and that may be the same document or it may be a different document. If you've got a CRO sending the submission, do you need to get it signed off by the sponsor first? Is that the same QC form or a different QC form? Very fashionable, all the rage these days, a form in which you assess whether the amendment is substantial or not, which is, when it is substantial, that's not very exciting, but when it's not substantial, it helps explain why there is sometimes no submission or why there is a notification rather than submission. So useful documents to have in there as well that would make this toy example a bit harder to explain to you. And having spent enough time on point one, point two, the second most common thing is to find exactly the same problems in zone 3 with the regulatory section. And it's really the same. The only difference that I'm aware of really with these things is that regulatory approval doesn't expire year on year. It doesn't require annual reappraisal normally, but you do have to send them an annual report. So it's even that's pretty similar. Anyway, pressing on. The third thing which you're likely to find. Now, not every trial, not in a trial that only has one site, probably not in a trial that has 5 sites. But by the time it's a global trial and you've got 40 sites, I think you're very likely to find this. You'll find a site that has all of the documents for site ID, site feasibility. You held a visit, you selected them, you approved them, you sent them a letter saying you're in. We're looking forward to working with you on this exciting trial. Thanks so far. And then that's the last document that's ever filed. The site was dropped, and because it's dropped, nobody ever bothered to do any filing after that point. There's often also a lack of communication with the site. You'll see a fair number of things that are sent to the site, but you might sometimes struggle to see anything that comes from the site. It's much more common to see letters that go to site than from site. And there's also a lack of document reconciliation. So what's the best practice here? Well, the best practice I'm proposing is that if you find an issue in the TMF, do something about that. And in this case, I'm suggesting, as I have done elsewhere, that information feeds its way through into the people who design, process, and create documents. So I think there should be a standard document called site drop communication. Now, I don't think we need a template for that. It's just an email that says, "Dear Dr. Smith, we are no longer as discussed, we are no longer using your site." But probably there's going to be a little bit more discussion before that. Probably an issue has come up and the sponsor has tried to do something about it and the site has replied. So there's probably a bit of back and forth. And maybe that's documented in the minutes of a meeting somewhere, impossible to find. Maybe that should be in the site drop communication. Maybe there should be a specific explanation for why it was that you said, this is a great site that's definitely taking part. And then the next day you said, this is not a great site that is not taking part. There should be some explanation of that. Maybe there should be a document to hold it. Similar thing with when the PI changes. Sometimes you learn that the PI has changed. Now, sometimes that's okay. Sometimes that was discussed initially and it was always the plan that someone approaching retirement has retired and their right-hand sub-I has taken over as was expected. And it's all going exactly as you thought. Other times, someone just disappears and another sub-I magically appears and becomes the PI. Are they suitably qualified? Are they able to use the same equipment? Are they in the same ward in the hospital? Did the sponsor approve them? And I think we need a document that describes those things as well. There are some other examples. A site TMF, sponsor TMF site file versus investigator site TMF reconciliation tracker. I've been doing this for 10 years and I've never seen documentary evidence that this has ever happened. Not once in 10 years have I seen a piece of paper which suggested that a CRA had checked the content of the TMF against the content of the ISF. I know they do that, and I know they do other important stuff too. It's remarkable to me that they managed to do that without a written document. It's extraordinary. Anyway, the point is, if you identify that something is not recorded in the TMF, can you feed into the process people at your company that actually this is a type of document we might need in future? Here's a thing that I think you'll find in more TMFs than not. File notes that just point at problems. Must be an absolute gift to an inspector. Coming to look at this TMF, I think I'll just search for the file notes and let them tell me what's wrong. It's very doubtful practice. Far too many file notes, when you read them, they start off strong. They describe a problem. It was discovered that. And then they sort of peter out, and there's a bit more explanation, a bit of detail is given. And then they finish lamely with, and so we wrote a file note. Worse still, sometimes the sentence begins with that. We wrote a file note because it was discovered there was a problem, and so we wrote a file note. And that really sounds like the waste of ink that it is. Just describing a problem is not what file notes are for. And it's not a very good thing to do. It's not very helpful. So, what's my suggestion? Well, you need controls. Have a process for addressing minor and trivial issues, which does not generate hundreds and hundreds of file notes. Small problems with templates of documents and spelling errors, for example, don't warrant filling your TMF with bits of paper that just say, look, here are problems. We're not very careful. We make mistakes. You can document that in metadata and attach it to the document. Don't fill your TMF until a third of it is just bits of paper that say, these other bits of paper are wrong. Have a template which outlines the important things that go into file notes. Specifically, an analysis of whether there was any harm done, and if not, a justification for that, and what can be done to avoid it happening again, which is beginning to move towards a kappa. It's not quite as much detail, but it's in that style. How is this going to not keep happening? And only let some people write file notes, because some people are very bad at writing file notes. And if you let them write file notes, you are as responsible for this as they are. Sorry to be harsh. Number 5, there is frequently confusion between central and local ethics, the stuff which is filed at country level and the stuff which is filed at site level. If it's filed at site level, it only applies to that site. If it's filed at country level, it applies to all the sites in that country or region, I suppose. Doesn't have to be a country, almost always is. The confusion over which drawer you put it in, which layer, which level. What can you do about that? Well, I would ask, does your site go event, whether you're calling that drug release or activation or initiation or screening permission, whatever it is you're saying to the sites that means they can begin doing screening and treating rather than budget negotiations. does that depend on documents which are in the TMF and final, or does it depend on a bunch of documents sat on someone's desk or shared drive? If the person has to fill in the form and say, yes, we've got A, B, C, D, and so on, are they saying we've got all these things and they're filed correctly? Because that person is the expert. That person is the one who knows whether it's local ethics or central ethics. And if they've already filed it and they're saying, yes, they're in the TMF and they're in the right place, you're off to a better start than if you have them doing this important work and then having done the important bit and got the site going, then you're saying, oh, and we'll do some filing, send it to the document group, they'll upload it. Second part of this, when people are filing documents, is it like putting the last piece in a puzzle where you can see, yeah, this fits right in, this looks good, this is where it goes? Or is it like popping it through a hole in the wall? I was actually looking for a picture of someone hurling a box of documents over a wall where they couldn't see the other side. But I was not able to find such a picture. With a bit more time and good weather, I maybe go out with my wife and a camera and sort that out for next time. But the point is, what's the experience of filing a document? Is it fire and hope, or are you actually putting something where it clearly belongs? Those are the best ways to get off to a good start with central versus local. Number 6. There will be a site delegation log which has lots of manual corrections on it. And it'll look horrible and it'll be awful. Now, some clarifications I can understand. If someone's surname is misspelt, I suppose you could correct their surname slightly. That seems reasonable. But if you're talking about the bit where you're saying the delegated tasks, and you're modifying by adding or removing or clarifying a designated task, one, those boxes are tiny, and you're going to cross out a number, put another number, and your initials and the date. I'm going to be wondering what's happening. I mean, if you're lucky, I'll see what you did, but I'm going to wonder why did you do that? Do you mean that this person stopped doing that task? Or do you mean that you wrote the wrong number? Or do you mean that you delegated that task to them in error? It's completely opaque and unclear what that means if you start scribing through the delegated tasks. So the solution is training. Apologies for the pun. Train your CRAs and your sites on how to complete a delegation log, and importantly, how to correct a delegation log. If there's something which is not correct about a row on the delegation log, then you have to close it off. You have to sign it off, and then underneath you put the correct information on a separate line. If you want to talk further about what was wrong about the earlier line, then you can do that somewhere else on another bit of paper. You almost certainly can't fit the necessary explanation into what is already an overcramped document. Whilst we're on the topic of handouts for training, so that all of your CRAs and sites are understanding the same thing, I hear sites ask for instructions on who is a sub-investigator. So a bonus piece of advice there: does your company provide information on who is a sub-investigator to sites? Here we go. Number 8, gaps in the sequence. Where is number 5? Now, we could be talking about study plans or protocol versions or ICFs or really anything which is numbered and version controlled. This indicates a lack of effective review of the TMF. The inability to file version 1 and version 2 and version 3 and version 4 of a document is often a really good clue that something is up. And if people are making this mistake, they are making other mistakes. I mean, if you can get this wrong, you can get things really, really wrong. Now, the solution is to review and correct. And I'm talking about a big picture review, not an atomic review, not a let's check the documents again. You could review those documents as many times as you like. They're all perfect. There's nothing wrong with these documents. You will never find a problem here. You will also never find version 5 here, because it's not here. You need the bigger picture. And to do that, you can't exclude what has gone before. You have to be reviewing all of the documents all together. No, Sandra, well done, well spotted. Another attempt at humor. This one, which is about a gap in a sequence, should be number 7. Yes, not number 8. And very much in the same vein. H, inconsistency. I love it when I'm reviewing a TMF and you look in the trial level and there's 5 ICFs and they got 5 names, and I see immediately, well, I know what those ICFs are. We've got 5 different ICFs. Terrific. And then you go to a country file and you find for that country, we've got 5 ICFs and they've got the same name. And you think, well, these people know what they're doing. Look at this. They have managed to produce a country version of each ICF. Then you go to another country and you find 4 ICFs, or you find it's a different set of names. And you start to think, what's happened there? Now, sometimes it's legitimate. Sometimes you go to another country and they make a requirement that you put 2 things together, or they say, well, you can't do that one. That's fine. That's an explanation. But in order to reveal this important information, you need to have a habit of naming your ICFs in a way that makes sense and reveals this. So drive consistency. In this case, I'm arguing that a metadata field, which has a drop down so that there is a limit to what people can pick, would be a good thing, because otherwise people just call everything ICF, and that's not very instructive, because it leaves you with a list of 12 ICFs and you think, oh, they're all ICFs. If only we could use the names in some way to tell them apart. Wouldn't that be handy? So, pressing on. Another thing that you see far too often in TMFs, given that we are document specialists and experts in this matter, is this is really 2 things. But auto-pagination. So you take a big Word file, said that wrong. Take a big Excel file, it's a big tracker. You've set it up, you've got every document's listed across the top, every site's listed down the side. And when you start, of course, the vast quantity in the middle is empty. And you stick it into your TMF system, and it turns it into A4 pages of PDF, which is not useful or helpful in any way, and it produces the one on the left. 9,800 pages of random rectangles, which is of no use to anyone. And then on the right, you file your TMF index, which is actually very useful information that you want people to be able to read. And it produces bits like that, which this is actual data. There's stuff there. This is taken from the reference model index rather than a real one. But you know, there's useful stuff there on how to file documents and where they go. But it's completely devoid of meaning because we've lost the headers and the row titles. So I've got some suggestions. If you're going to put big trackers into a system that produces A4 print preview PDFs, then learn about using print area and page layout. Learn how to put the row and column headers on every page so that at least you know what you're looking at. If you are going to have 100 pages of this stuff, at least have the headers and titles on it. Learn about minimizing the margins. Consider having a tab, which you make the print area, that says this is a large Excel workbook and cannot easily be viewed as a series of A4 sheets. You can download the document and look at it if you need it. Another option is the information which is on the screen. Yeah, absolutely. You can download the information, but sometimes it's nice to see it on the screen too. So on here, there is a solution to this. You can produce a PDF before you upload it, which is often something you would do, and particularly if you were downloading documents to give to an inspector. You can change the page layout in Excel. In Word, you can do that freely. You can make your pages almost any size you like. In Excel, you can't. It is determined by the printer driver. So go and get yourself a nice printer driver like this one, and then you'll be able to produce PDFs which are really, really big. You don't need to buy the printer. You just need the freely available printer driver, the software. You install that, and then you can do the page setup, the print preview, and tell it you're going to print it to a huge big chart, and then export to a PDF, and it produces what you're after. Here's an example. This is the reference model again. That's the whole of the TMF reference model produced on one PDF. And the little clip there is zooming in. So you can see there is no loss of precision. There is no blurriness. It is a proper PDF. You can zoom in and read it. So there you go. If you want to make bigger PDFs, there is a way around these system limitations. 10, which is surprisingly not final. There's gold hidden in them there hills. The relevant communication and file notes. There's something valuable in there, I bet. Misfiled, the dumping ground of the TMF communications. In a way, everything is communication, which is why stuff gets thrown in there. In a way, you write it down to communicate it to someone, or possibly yourself in the future. So it's sort of justifiable an awful lot of odds and ends get thrown into relevant comms. But then we say, well, it's all random, it's all, it's never, if you're doing a risk-based review of the TMF, it's never the most important part. And if you're not doing a risk-based and you're reviewing everything, you're going to struggle to identify who should review the communications, because it's hard to say one person is responsible for this stuff that everyone produces and throws in there. So there are reasons why it doesn't get reviewed in quite as well as, for example, the protocol artifact does. I hope you get that one right. Communications, I get that, it's harder. Doesn't belong to anyone. My point is, to get to the point, you need a bottom rung of your risk review strategy, which is not 0 checks. You can't leave it out because stuff is misfiled. You can't afford to say, well, you know what, this particular type of document, this artifact, is just not that important. And so because we're limited for time, we're going to focus on the stuff that is important. Because how do you know someone hasn't stuck something really important in there by mistake? So limited checks, absolutely. 0 checks, very hard to justify. And a bonus, just in case you didn't like one of the 10, versioning. There will be some problems with versioning. I'm hopeful that you know how to count and are probably quite expert at this and make very few mistakes in your day-to-day life of counting from 1 in sequence upwards. And yet it happens surprisingly often in the context of clinical trials when we're apparently concentrating that we start making errors with versioning. And all I could come up with for this, have you got a set of widely shared written instructions which everybody understands in the same way? Because my experience has been, if you look around, people are doing all sorts of stuff. And that suggests that we're not all doing the same stuff. And that suggests that might be where the problems are coming from, if we're working together with different understandings. So would a set of shared written understandings help everyone? And that gets me to the end of the sort of 10 things that I would heartily expect to find most of in your TMF, if you invited me to come and look for problems in your TMF. And we'll have some questions, I think.
Thank you so much, Daniel. That was very insightful. I will go over to check on the questions for you. Reminder, just post them in the Q&A section and Daniel can go over them for you. So our first question.
Hi,
is,
guys. Daniel, if you can just remove your screen from, oh no, can you remove your presentation from the green room? Perfect. Thank you so much.
Sorry about that, guys. Just a few tech issues. So the first question, wondering if anyone else has the ISF checked TMF good tick box on monitoring visit reports.
Sorry, is that a question for me, Jennifer?
It is.
Can you say it again? Sorry, my computer is getting rather hot and the fan is going very loud.
Oh, no problem. Can you, wondering if anyone else has the ISF checked TMF good tick box on monitoring visit reports?
You do see that. I'll say I used to see that a little bit more. So yeah, there is very often in the monitoring visit report, there is some record that there has been some checking of the, some reconciliation of the documents ISF against TMF. And I've definitely seen some people tick that box who did not have access to the TMF. So I'm assuming, without my knowledge, someone on the team must have been supplying this team of CRAs with bang up-to-date knowledge of the TMF. That must have been the case, because the CRAs were ticking and signing off that they were doing this. There are other situations, of course, where the CRAs do have that insight, do have that access to the TMF, and so they could well be doing that. And you could look at the audit logs and you could say, well, this is the 5 days they were on site. Five days? Why did I pick 5 days? These are the 2 days they were on site. And you could say, well, did they actually log into the TMF while they were at the site? And that would be an interesting check to do as well. And again, I think my point is, how are they doing this without writing it down? So,
Perfect. And just a follow-up question to that, actually, Daniel. It's from the lovely Fran. Can you give a few examples of good NTFs that you've seen?
A good NTF would be something which almost, almost constitutes like a dealing with a quality issue which is not important enough to become a quality issue. So it would describe the problem, it would account for the origin of the problem, it would describe what was immediately done to correct the problem, and it would describe the analysis that said what's the impact of this problem, and then it would say what are we going to do in the future to deal with that. That's one type of NTF. It's a sort of mini quality issue record, I suppose, report. The other type is where you're literally, you just don't have a template. You don't have a type of document for a situation that you find. And so you take out a piece of paper and you give a full account of the situation. Let's think, if you had sites in the Ukraine, then it's very unlikely that they're operating as normal. I suppose it's just about possible in the Western Ukraine that they might just be, but probably not. So you're going to have to explain what you're doing, and you probably didn't have a what happens if there's a war at site document prepared. So in those cases, you're just taking a piece of paper and you write what you're doing, and you file that as documentary evidence of what you decided to do at the time. And you don't need to say this is a file note, and you don't need to say this is a file note that we're writing because. You just say on this, essentially it's meetings of a minute that you, it's minutes of a meeting that you've not had. You're just documenting your thoughts. So those are fine too.
Perfect. So Rahul asks, how do you manage minimal risk to low risk as well as high risk benefit?
How do you manage minimal risk, low risk, high risk, risk benefit? I'm not sure what area Rahul is driving at there. But
Rahul, if you want, we can put that on pause. And Rahul, if you just want to maybe clarify your question a little bit and resend it, we can definitely go back to it.
I will say one thing about risk, which is I think that it's a very good idea to have a trivial risk or trivial harm category. Whenever you're assessing risk, you often see people, we assess stuff on a scale of 1 to 5 or 1 to 4 or whatever numbers you like at the top end. I'd be a big fan of having a 0 category as well, so that you can document, we found this, we looked at it, and we decided not to do anything about it. This is a 0. We found that there is a spelling error in the template. There is 0, we see this, but there is no point in doing anything about it. There is no risk to patient health. There is no risk to data integrity. There's no point in us doing anything further. Simply, we've seen it, and we don't need to see it again. I mean, you could say that you've gone and corrected the template, I suppose, but it's still trivial. So yeah, there you go. There is a contribution. I would argue for a 0 when doing risk assessment.
Great, thank you. So Sharon asks, how can we get the industry to type out the DOAs?
Dreadful old acronyms. I don't know what DOA stands for, which might be the point of the question.
Well, that's okay. We'll move on. Sharon, if you just perhaps want to clarify your question, we can definitely add that to the end. Farzana asks how TMF is related to clinical trial management system.
So it's very nice if your company has the ability to hold clinical trial information and clinical trial documents in systems that talk to each other, or in some cases in one system which holds both. That can be very helpful if your TMF essentially is already aware in the background of things like important dates of trial events and the people involved in the trial. That's all information which will make your TMF richer and which will make checking it easier. What have I seen any common problems? To be honest, no. Most of my experience over 10 years, I've worked with TMFs that are integrated. It's not been common enough that throws up its own type of problem. Can I immediately guess what that would be? What would happen? It's probably, if you integrate stuff, you remove people's ability to correct and accommodate difficult situations. So I have seen in integrated studies, they have terrible problems numbering the visit reports, because once you start a report, it gets the number. And so if someone starts one by mistake, that number is then taken and can't be reused. Or if 2 people go on a visit and they both write a report, it takes 2 sequential numbers, even though there was only 1 visit, and that throws things off. So there you go. There is a problem that comes from that kind of integration. On balance, though, you've got far more benefits than that relatively minor thing that we could probably do something about.
Perfect. Well, thank you so much, Daniel. If anyone has any additional questions, feel free to send them over to marketing@montrium.com and we will get the answers for you. So our next session is going to be TMF metrics. They aren't just for marketing anymore. So hopefully you can join us at 11 Eastern. So now it's time to go over network. Join us in the lounge or the virtual booth. You can chat with your peers, colleagues, meet new people, or just have a good time. So everyone enjoy the final day of TMF week. We'll see you soon.